Hmm. Hmm. I don't hear the problem. Hi, hello. I'm sorry, there is some echo here. We have number of participants in the Zoom. Dr. Rakesh already there. So this is something. It's not symposium. It's not the uh, other scientific session. This is more on the working group and the tobacco control section meetings we are having here. The good thing that we would like to discuss here more how tobacco control and TB control can work together. And we all know that tobacco smoking or tobacco use is one of the most significant risk factor for tuberculosis in many ways. So from the health perspective, from the economic perspective as well, and from the social perspective. So the idea here really to discuss with the team, both so we have a number of participants online here, as well as the in this room, how to really do the action on the ground. We have the evidence already about the tobacco and the impact of tobacco smoking, TB programs. But now time is to really change the evidence into policy and policy into practice. Where the TB control programs, the role is really the important. and also the tobacco controls, the program managers are also the key to really advocate TB and other programs for the integration. So in the panel discussion, we have the Dr. Rakesh Gupta, who is the chair for that Union Tobacco Control section. We have Dr. Akihiro Okada, is from the Research Institute of Tuberculosis, Japan, and he is the co-lead of the working group Smoke-Free TB and Smoke-Free TB. And we have also some senior the officials from the governments and the civil society here as well. So in this, I would like to request first to Dr. Rakesh to just provide a quick overview from your side, how to make a really action on the ground to integrate the smoking cessation in TB control program, and how the tobacco control and TB control program managers work together to build such a wider, the advocacy and the integration in program. Dr. Rakesh?
Yeah. So am I audible?
Yes, please.
Okay. So I think TB and tobacco, they are integrated with each other. And it is always good to integrate the TB elimination program as in India with the National Tobacco Control Program as it is said in India. So as it is, the nomenclature is like that. Anti-EP and anti-CP, right? So how can smoking cessation interventions be integrated into regular? So this was your question?
Yes.
Into regular TB programs.
Yeah.
Yes, Tara Singh? Okay. So I think the smoking cessation interventions can be integrated into the regular TB programs, and we can use the A, B, C, D. Actually, I am adding D because the A is for ask, B is for behavioral therapy, C is for comorbidity management. Comorbidity means like the people who are smoking, they may have constipation and they may have cough. So comorbidity management is must. D is for the drugs therapy. And we must also ask them about the 5 A's. That is ask, assess, advise, assist, and arrange. So these are, I think, mostly they are the part of the cessation treatment. And briefly, we must ask about the patient's tobacco use status at every visit, briefly advise them to quit, and we must also provide cessation support or assist or arrange follow, offering strategies to manage cravings, and we must incorporate into existing documentation like the TB treatment cards and registers. We must incorporate into those, and we need to provide targeted training, maybe a 1 day or a half day course to all the healthcare professionals which are involved in the TB treatment, and we must establish a tobacco-free environment for them. And we need to coordinate, as I told you earlier, that anti-CP and anti-EP, they need to be coordinated with each other. And we must also utilize the community support, especially the family members. And beyond the clinical settings, example, during the home visits for directly observed treatment. So we must utilize that time for providing support. And we must use job aids, simple job aids and IEC material for giving them tobacco cessation advice. So this is my take on your question.
Thanks, Dr. Rakesh. I think
yes,
that's
Dr. Talsi.
Yeah, thank you. So now I would like to request Dr. Okada to briefly provide the impact of the smoking in TB.
Yeah. So it is well known that tobacco smoking is really significantly attributable to TB disease. So it estimated 15% of population attributable risk globally. So we can even from tuberculosis, 15% of the new tuberculosis cases if we stop smoking among the people. So the second one is TB. Tobacco smoking is really significantly attributable to TB diagnosis delay, and it decreases the success rate of tuberculosis and also increase the relapse rate that the evidence shows like that. So it's really tobacco smoking is really negatively affect the tuberculosis control. So we cannot ignore the tobacco smoking as one of the risk factors to negatively affect tuberculosis control. And in addition to that, we have to take into account that passive smoking program. So the passive smoking, tobacco smoking is also significantly attributable to TB disease amongst the domestic secondary smokers like kids or other smoking people who live together. So this is evident. So in that sense, not only we do need to target such the three pillars perhaps. One is common general people, of course, as a strategy, as a policy to reduce the tobacco consumption amongst community members, and targeting the TB patients, and so to reduce the smoking rate amongst the TB patients. And in addition to that, so the family members, so we have to take into account control of passive smoking to protect the kids or family members from smoke. So in that sense, we do need to take into account these three pillars. So from the tuberculosis point of view, control point of view, as you know, the tuberculosis control have kind of the advantage to take care of the TB patients at least 6 months once we make diagnosis. So we go together at least 6 months, and then beyond you can make kind of communication beyond that, of course. So in that sense, there is no question as far as tuberculosis control program really taking account this great opportunity to reduce the most hazardous, toxic agents or addiction or hazardous to health, I suppose.
Yeah, thank you, Dr. Okada. I think one of the things that we would like to really discuss here is the program, the integration. The union has, they developed a guide on smoking cessation and smoke-free environment for TB patients long time back. I think it was published in 2010 that highlights the key, the issues, how to integrate and what are the steps that needs to be taken. I think we have several, the pilots of that guide in Africa and also in Asia and many other countries. We have some people here. Professor Linian here, Dr. Kopto also here. They have a rich, the resources and information about the, possible collaboration. And one thing I would like to hear, I think mostly we are from the TB control program. From this morning, I think until now, I have attended several sessions, the earlier. People talk about the risk factor. People talk about the determinants of the TB all, and they talk about the TB diabetes, TB HIV, and there are other risk factors. I haven't heard from any of the experts about TB and smoking, and this is the lung health conference, and the tobacco smoking is one of the major risk factors for any lung health issues, whether it's a tuberculosis or COPD or asthma or anything. We all know, I think there was no focus. There is no focus still. How to really build such, I think action-oriented our activities on the ground. That is, we really need to integrate smoking cessation in a regular TB services, whether it can be at the health post level, or it can be at the hospital level, or at any level. We must start something. And it is not that difficult. We don't need the medicine. We don't need the sophisticated clinics. What we need to the TB control programs the service provider, they have to just ask simple one or two questions. Do you smoke? And it starts from there. Then accordingly, if the person don't smoke, if the answer they don't smoke, maybe they can provide some brief advice. If smoking, also we can also provide the brief advice to quit smoking. In this regards, maybe I would like to really request maybe Professor Linian, your experience, in China and also in Africa and many other areas. So whether or not it's possible to integrate smoking cessation, and from your perspective, what are the key challenge you see the TB control program managers, they are not adopting this. It's only talk. So we have been this, in the working group since 2010, and we have done a lot of things. Only talk. And I don't think any of the country has well implemented a smoking cessation in a regular TV program. We don't have any good example. I don't know, maybe in some developed country, but I don't know. I don't have that one. There are many pilot programs have been done, but we have no idea. And also we have here Dr. the Anu, and also the Dr. Imran. And by Imran, we have published one paper. I think during the COVID, we have written one paper why the tobacco, smoking cessation or smoking related indicators haven't been incorporated in the joint monitoring mission. So even the WHO, the joint monitoring mission, they do the program, the review for every country. So we hardly see any of the indicators, included in that mission. There are indicators about the HIV, TB, HIV, indicator TB, diabetes there. So, but not TB and smoking. So anyway, the last joint review in Indonesia, it has been included here. So there are many issues. So at the global level, at the country level, and also sub-national level. So again, I would like to back to the Professor Linian. What is your opinion? How to make the TB and tobacco control program manager accountable to integrate smoking cessation? It is needed. It is needed now. Yeah, you can also use it.
Okay, thank you. Actually, this is a very good entry point. Why the tobacco control issue in TB clinic, TB service is so important? There are three very important phases of effect. Number one, among TB patients, the prevalence, no wonder you will be smoking, the prevalence of smoking, TB, the tobacco use, in TB patients is higher than in general population for same time, same catchment area. Number two, the smoking is very important recognized risk factor for TB, including TB infection, TB disease, severity, and the treatment of TB. Number three, the last point, based upon the practice, integrating smoking cessation into regular TB service is effective, is doable, and is one of the great facilitators to improve TB treatment outcome. So that means if integrating tobacco cessation into regular TB service would be greatly benefited tuberculosis care in many countries. So based upon the research and the experience, this is very important entry point. TB service. So every TB program manager and the TB service provider should. Thank you.
Okay, thank you. Thank you, Professor Linian. So I would also like to request to other, Imran, would you like to say something? Any from the strategic some guidance, some advice for how to really make sure. It's not about Indonesia, but also in the global. So you are the global champions and TV. So we need your advice. Or you can use here, this one here.
Yeah, thank you. So I think
Dr. Tarasi, we have an audio issue. Can you just make it better?
Okay.
Your voice is okay, but
Yes,
not
sorry.
for the panelists.
okay now.
Maybe it is because it is in
Yeah. So yeah, thank
hybrid
you,
mode.
Pak.
Maybe the reason for that.
So I think, like you mentioned, that TB and smoking is very close related, yeah. And what I understand, every year that smoking is one of the best 3 or best 5 something that may endanger TB. But what I see there, especially in Indonesia, the lab, even though we are trying to have more collaboration about smoking cessation and TB, but still it's not popular in the health offices. Maybe because of the structure of the program is different one. Tobacco cessation is under the non-communicable disease. TB in the communicable disease, and sometimes then it's how to align. It's easy to say, but it's quite hard to do in the services. For example, like this one. When I was assistant program manager, I want to have like piloting in some health centers about TB cessation, TB and cessation. But always, the question is if the patient from the TB have smoking, who will be what we call consult? Should the patient should travel to the what we call
Smoking cessation clinic?
physician or the what we call smoking cessation will come to the TB clinic. So that's like very simple, but it's always asked. So I think, maybe we can have more strong recommendation, especially during Indonesia during external monitoring mission. So, and I just realized you mentioned that when I checked and I realized that 3 or 4 times we have TB, they haven't put the recommendation about this. So I think if we put and it will be like combination with the combination, so I think the country will be succeed for it. I think that's my comment. Thank you.
Thank you. I think that's an excellent comment. So it's when Imran, when he was the program managers, and also the CDC, the director there. So he made really good efforts to integrate the smoking cessation in Indonesia. And as I mentioned earlier, we have published one paper as well to highlight this issue. So finally, the recent one, the Joint Monitoring Mission for Indonesia. So the very good recommendation there about the smoking cessation and the TB integration. So I think it's a time to really implement those recommendations into at the ground level. So thanks, Imran, for your advice. And then we have also, I would like to hear something from the union side. As I mentioned, the union has published a guide long times, and actually they have been working on smoking cessation for a long time, since 1994 or 96 something, from that point. And several efforts have been made, and there are several pilot programs have been done, and good evidence. As Professor Linian just mentioned, evidence are already there, available. Only how to use those evidence to change the policy and how to implement those policies that already exist. So the union has a guide. So I think one of the points of guide that was published in 2010, and now we have several other evidence that is not, the guide focus more on the smoking. Now we have another challenge, that's the e-cigarette, the vaping. So how to really tackle those things. So we are thinking to help the union to revise that guide, if possible. I think that can be also one of the key the output of this working group. So Dr. Kopto is the director of the TB control department at the union. I'm sorry, I'm from tobacco control, so this is. So we'd like to hear from you, Dr. Kopto.
Yeah, thank you very much, Taha. Yeah, but what you should mention regarding this guideline is under your leadership. I think you forgot this, and also we bring up this guideline from the union. So I think after several years, we have now more evidence, more research, and this approach, the union ABC approach, is still relevant. And I totally agree with you that this guideline should be revised. And we can here we can continue the discussions because we include in our CDC counter the data of some of our guidelines, and this guideline is included, so we can discuss better to see the best way. As I said, you were part of this guideline, Section 1 with Professor William, and yeah, you have a great history of TB and tobacco control in several Asia and many Asia that we are bringing this Africa experience, I would say. So we are totally so I would like to make a comment on your previous question regarding the barrier.
Yeah.
The barrier.
Please.
Okay. Yeah. When, as I said, I've done many operational research showing the relation between TB and treatment outcome, and the tobacco use and the impact of treatment outcome, and also the relaxant. Okay, so from our experience, to implement, for example, in French-speaking countries, Benin and Burkina Faso, where we implement the union approach ABC, when we discuss with NDP staff, what they say, yeah, you want to implement it, so that means you will request indicators, additional indicators to to follow these activities. So, but currently we have many indicators to collect. So, and there is sometimes the main barrier, I would say. There's okay, other indicators, and we forget that in these TB clinics, the nurse, the healthcare worker, they are not doing only TB. Well, the structure, they are not doing only TB. If you have 100, for example, 100 health facilities in the country, and you say, okay, 10 of them are TB clinics, okay, these nurses in these 10 TB clinics, they are doing first the same activities as the 90 other nurses are doing. But we are adding TB activities. So they say, okay, nothing. So this is, I think, the main barrier. But we have some opportunity now. If you have digitalization, this can be digitalization.
Yeah.
It's easy to be implemented. And we can also think about some opportunities because currently, of course, we mentioned that tobacco laws has an impact on the relaxer. And you can see that now we are talking about post-TB. And I don't think that there are many operational research regarding post-TB. So I think in the coming years there will be more for this area, so we can be strategic. We say, okay, let's maybe develop things in this area, TB, post-TB, in fact, not relapse relax, we were the post-TB, and be aware about all the opportunities to implement these strategies in the country. And regarding funds, it's a real challenge. In Burkina Faso, when we implement the operational research, as I said, the additional indicators, but the MTP say, okay, let's improve it. They include just one indicator regarding who is using tobacco, but the completion rate of this indicator very low, very low.
Right.
That's why we need technical assistance too. So but I should welcome this working group in this very important topic. So that could be my contribution.
In extension of what you said, so I suppose I'm relating to the revision of the Green Book. We call it Green Book, published by Union 2010. Yeah, 2010.
Yeah,
so, ABC book. So maybe 3 points I have. So one is as you said. So we have to have a kind of a simplified recording and reporting system, and then with very minimum indicators. so and then preferably electronic way. So that the burdensome that the field workers feel whenever they have new things, they feel a bit fear, right? So because it can be a big burdensome for the field workers. But asking that kind of thing, that the simple indicators indicating that smoking, yes or no, and interventions, what intervention they have, and perhaps probably the domestic smoking situation. For me, the three essential things. So whenever they have a kind of meeting or the opportunity to provide a brief smoking cessation intervention. So and then what happened to the smoking status, and what happened to the domestic passive smoking situation. That may be the really minimum essential indicators to evaluate the TB and smoking collaborative work. So and then taking account that we do need, of course, we have to implement a kind of continuous training, of course, and emphasizing that smoking control is really should be one of the essentials for the tuberculosis control. So that the impact should be very huge, and we can see. So that is the core message that we have to do. And then the burden, it's really minimum, like we learned from China. in hospitals in the Philippines also, we also try to do it. And then we feel that recording and reporting system should be simplified, and the indicators should be very much essential minimum. This is really the key things we have to take into account whenever we try to implement smoking TV. And so,
Yeah, thank you, Dr. Okada. So yes, as per the, I think that you have done some, the pilots in Manila, in the Philippines. So do you mind to just briefly share what's because it's you really work with the governments, the Manila,
Manila city
government.
Manila city government really try to implement.
So what are the lessons learned from the government perspective? There.
The one thing is it's possible. Another thing is should be simplified. The system should be simplified. This is really key messages. So that is really linked to the division of the Green Book.
Yeah.
So that's what we learned. Yeah, it's in order to sustain this program, really we do need a simplified indicators, a simplified reporting system. Otherwise, we can't continue it.
Good, thanks. We have here the Jonathan, who is the really pioneer in this area, in the research, and also provide the technical assistance and all the things. So would you mind to share something from your perspective, how to move forward about this working group, and how to really build the accountability of the program managers?
Oh, sure. I'm Jonathan Gall, and I Professor at Johns Hopkins do some research on tobacco and HIV and tobacco and TB patients. I think listening to what a lot of, and coming to these meetings for many years, listening to a lot of what's going on and being pretty well versed in the literature of what's happening with TB and tobacco. I think that there is a lot that everything that was said, I think is great, and we know it. And we've known it for a long time. We know that when a person was diagnosed with TB and they smoke, it's a great moment to try to change their mind and say the TB was due to their potentially partially due to their smoking, and if they quit, then they can have better outcomes. Of course, we know that one of the challenges there is there's a lot of places with very good outcomes that already, even if you show that people quit smoking, you may not show improvement on their outcomes, which you don't want to get people down and say, oh, it's not a big deal to quit smoking just because you don't have bad TB treatment outcomes. I think one of the key things to focus on there is that it's not just for the TB that we're getting them to smoke. We're getting them to stop smoking, getting them to stop smoking for the rest of their lives, and to try to show that downward positive impact. And I think we're talking about that a lot when we do cost-effectiveness analyses of smoking cessation. I think it's key to include that it's not just, hey, we're going to improve TB treatment. But if this person quits smoking and continues to quit smoking, they're going to have a lot less stress on the healthcare system for the rest of their lives, contribute more healthy work days and work years to their populations. So I think that's the messaging that needs to go out a little bit more, that we can do this during TB treatment. I think it's similar messaging that people are doing when we have TB treatment. People who took over TB treatment of diabetes, and that's gotten a lot better framing than tobacco has, as you mentioned, and even alcohol. But if you can get all these people to quit these things during TB treatment and have them stick, and a lot of the studies, you'll see studies on smoking cessation on people with TB, and you'll see that they're usually very successful in getting people to quit smoking. Why? Because they're scared. They smoke right now, and they're coughing anyway during their TB treatment, so tobacco doesn't help pile on top of that. The key is, though, 6 months after their treatment's done, are they still not smoking? And that we have very little data. There are very few studies I have seen that have followed people beyond TB treatment to see if they continue to quit smoking. And that's what we want. We want durable interventions that are going to get people from scared, that are going to last beyond that when they're not as scared. And we all know that when we ask a TB patient if they smoke, they often say no. And if you ask them when they quit, they say 2 months ago. And they say, when did your TB symptoms begin? 2 months ago. So it's not that they quit smoking, they just stopped during their TB treatment. And 2 weeks later, when they're feeling better, or a few days later when they're feeling better, the first thing they do is go light up a cigarette. So I think it's very important to get that messaging out, that even if a person says no, they don't smoke during TB treatment diagnosis, there's still a good chance they do, and you got to ask them again. And that gives you multiple opportunities to assess them and to provide this treatment. And smoking cessation is one of these things. We're talking a lot about post-TB in this conference, and everybody has been for a while. We want to address all these things as soon as a person's done with their TB treatment. They're done with TB treatment, we're giving them diabetes, they're giving TB, tobacco, cessation advice, we give alcohol reduction advice, try to do everything. Well, why not do it during TB treatment? And I know there are lots of challenges that brought up. The TB workers are already overburdened. And whether we have to come up with the right strategy to have either people there that are specifically there to provide care for these other comorbidities, or to provide care for tobacco cessation, or train them. And I know that we want to say it's simple, one question, and then offer them advice, the brief advice. The brief advice is strong, but sometimes it's not enough.
Yeah.
And that brief advice needs to be carried out over and over, and maybe additionally in some settings, the brief advice needs to be followed by maybe replacement therapy or varenicline or something that's available in that situation. So I think that I'm not sure if I answered your question, but I mean, those are my thoughts, that we're kind of focused just by saying, hey, this is a key teaching moment. Let's get have people do smoke and get them started on smoking cessation. But sometimes that cessation is not on the trust.
Thanks, Jonathan. I think this is something, it's not about if we just look at the TB treatment outcome, of course, that is the first, primary indicators to improve, but it has a long-term impact. I think there are also Professor Linian, so you have, you have done the follow-up, right, after the TB treatment, in China or somewhere. So would you mind to share quickly about the results? So still, you found the people still remain the quitter, or back to again start the smoking? Do you have any suggestions for that?
This is really how is the smoking tobacco use related to the lung function after TB treatment? So based upon the current research, this is one of the areas we will do more work. Our preliminary work, including two aspects. One is we study cohort of patient, kind of patient, who almost followed about them for 7 years. Then we see how the smoking and the quick smoking status related to tuberculosis recurrence later on. So this is one step. The other one, from the operational research point of view, we should also observe all the smoking and related to the lung function after treatment. But this one is really very limited, so we need more research and more data on that. Suppose our hypothesis is like that, similar to COPD, this would have a lot of influence on the lung function. So we need more research like similar to the CPAP. So this is one of the area
Thank you, Professor Linian. So I think we have several, the participants online as well. So please feel free to, put your questions or any comments in the chat box. You can see also Dr. Himanshu would like to say something or some opinion from your side about the integration of smoking cessation in TB control program. Okay, maybe there. So
I think Dr. Himanshu's audio is not that good. Maybe.
Okay, that's fine. So, Dr. Rajesh, now again back to you. So, what is your the advice now going forward of this tobacco control section meeting and the smoke-free working group, how can we build some key tangible agenda for our action in coming years?
Yeah. I think you talked about electronic cigarettes. The tobacco cessation methods for electronic cigarettes is not different from what we use already, like the behavioral counseling and the pharmacotherapy. So we can use the same method for electronic cigarette or the vaping as well. And there are some challenges in the integration of the TB and tobacco, right? And I think we must know about the challenges also. It may be provider related, and that may the healthcare profession may be the workload may be very high. They may be lacking in the training, and there's very limited motivation or the capacity building is there, and they may consider it as a low priority area, the cessation for TB patients. And there is some patient related also, like the patients maybe having some psychological distress or stigma because when the TB is diagnosed, and there may be withdrawal symptoms from the nicotine as well. Difficult, and they may be having difficulty in accepting the pharmacological treatment, and the TB treatment is very long, and there may be some stress related to that also. Then there may be some systemic and resource related challenges also. So there may be inadequate infrastructure, inadequate funding, there may be lack of political will, and there may be insufficient coordination between the TB and the tobacco control programs, and environmental factors that is conducive to smoking, that may be a challenge because the smoking may be going on in the atmosphere, and what cessation methods we can use. So it's better if we combine both, like the behavioral counseling and the pharmacotherapy. The pharmacotherapy, varenicline and bupropion is available with us, and we can have different kinds of NRT also, like lozenges, like patches. There may be combination of that, the tobacco gums also, nicotine gums also, and up to 2 milligram in India they are available across the counter. So these can be used, and they may be integrated. They may be combined together.
Okay.
So
Thank-
So I
Thanks,
think
Dr.
tobacco cessation is must if we want to have a good results of the treatment of the TB patients. Yeah.
Excellent. Thank you. I think you raised there are some challenges, but we need to overcome. I think the challenges that you have just highlighted. We have been discussing this for a long time, almost decades and decades.
Yeah.
Now is, I think, within this the environment. This morning we have heard that we are really in a different world. We see our world, and we we have to find another world as well. Always there will be the limitation of the resources and other things. I think now we need to really find the ways to really make an action and the integration of this smoking cessation in the regular TB programs. So maybe here I would like to also request to hear something from Bobby. Bobby is from CNS. Bobby, you have some opinion or advice
Yes,
how to build the accountability of the governments from the media perspective.
yeah, thank you. Can you hear me? Is it okay?
Yes, we can hear you.
All right. Okay. Thank you so much, Dr. Tara Singh Baum, Dr. Rakesh Gupta, and everyone. Great to see this session happening. It's such an important issue, and you are very right, Dr. Baum, that in a lung health conference, how can tobacco control take a back seat? So it's very important that you brought it back on track. I just shared in the comment box a very positive integration at district sub-local level I found in mountainous district of Kangra, where Dr. R.K. Sood, who's the district TB officer, as part of the TB program, these vans go to screen people in remote areas, and now district tobacco control program people have also joined in, and they go to do IAC. So while they are screening everyone regardless of symptoms with AI enabled x-rays and offering molecular tests to those who have presumptive and TB preventive therapy who are eligible for TB preventive therapy. Everyone is also getting educated about tobacco hazards and perhaps maybe linkage to cessation, which I'm really not very sure about that. But at least it's a good integration example. I think it is very high time to hold governments to account, because we cannot end TB unless we end totally 100% preventable risk factors like tobacco use. So for tobacco use reduction, we have very low, very targets which do not have any ambition. So, and for TB, we have such a high ambition, which is so true, which of course we should be ending TB, but we also need to end tobacco use for so many other health benefits, not just TB, but it will also reduce risk to so many other infectious and non-infectious diseases. And it is high time to hold governments to account to walk the talk on SDGs. And I think when they talk of one goal in silo, we also need to remind them they also need to do better on malnutrition, HIV, diabetes, and all other risk factors. And tobacco control cannot be left behind just because there is an industry which is benefiting and keeping profit before people. Thank you for giving me this time. Thank you. Back to you.
Thank you, Bobby. Yes, please. You have to come here so that the online participants they can also hear you. Thanks.
This is Professor Beykuş. I'm from Turkey. I'm the chair of Middle East section of the union. So I have some comments to the previous two speakers. I'm not able to mention the first online speaker's name because it was not visible on the screen. But I have to open a parenthesis regarding electronic cigarettes for smoking cessation. Actually, I think it is an area which should be prevented strictly in smoking cessation for TB patients, because it is not a real cessation. It is a shift. So now these patients come with dual smoking or triple use of tobacco products. So I think we should avoid electronic cigarettes in this approach. And if the topic is smoke-free TB and tobacco control, I think the committee should focus some key messages related to the public, that importance of smoking cessation and prevention of tuberculosis infection. When we consider the pathogenesis of TB infection, it is important to smoking cessation. Well, some notes, and thank you very much.
Thank you. Thank you very much. So we have a couple of minutes. Dr. Rakesh, would you just highlight something? That is a very good point. Also, is here. The industry, they are actually, the tobacco industry and also the vape industry, they are promoting their device, actually the e-cigarette vaping, as a tool for the smoking cessation. Do we have any?
Actually, the people who are manufacturing tobacco and the electronic cigarettes, mostly they are the tobacco industry is involved into production of the electronic cigarette as well, and they are promoting these as cessation devices. Actually, they promote dual usage, and they are not rightly speaking, they are not the cessation devices. And we must, I think, be aware of the motive of the electronic cigarette manufacturers. So that is my take on this. And because these are not cessation devices, and we must only use those cessation pharmacotherapy which are approved by FDA or DCGI in India, and not any other product should be used for cessation. So of course the behavioral therapy is the same, and that should be used along with the pharmacotherapy.
Yeah, thanks, Dr. Rakesh. And there are some other questions, Kopto. Maybe I would like to request you to respond, or not respond, your comments. Some question here and comments, whether there is any country, we have where the smoking cessation well integrated within the programs, for example, in TB control programs. Do you have any example, like, I don't know, you mentioned Benin or
Yeah, you can share the Burkina Faso. I already mentioned that we implement operational exertion. Then the only indicator that say the integrating system is if patient behavior smoking on smoker. So, and I mentioned they say, okay, let's include it after several discussions. But the 1 year has the completion rate of this indicators very so that's yeah, we all know about the challenges, and it's not easy to implement it. And if I may, Tara,
Yes, please.
maybe we also need to focus on political commitment at the beginning of our activities. And you do not have ask me the question, but there is other opportunities. Maybe it's important to mention because we will have soon point of care to diagnostic after several decades. Okay, so this will allow the decentralization of TB in health system. Because currently it's only in TB clinics the diagnostic is done, and the other health facility they send the sputum to this TB clinic. But with this new tools, it will be decentralized, and it's an opportunity to include more health facilities and to provide big tobacco cessation support. So it's a great opportunity. So things are moving very fast.
Thanks, Dr. Gupta. I think this is something really great advice. And now, I would like to request also Dr. Anu here is the former DG of the Ministry of Health Indonesia. So for your quick remarks, Dr. Anu.
Thank you, I'm Anu from Indonesia. So when we are talking about the strengthening the collaboration, it's not only for the program manager itself, the team. Because when we are talking about the TB control and also we are talking about the smoking cessation, we have to also to have opportunity to empowering the family, empowering the community, because in the family, especially in Indonesia, there are a lot of action that when we are talking about the TB program, it's passed through the family. How to the family also help them to monitor the drug, the drug and so on and so on. And also in Indonesia, we have from the profile of the TB disease that mostly it's come from the lower income. So why the family is also important for that, I think it's better because now in some of the villages, the district, we have no smoking area. We have also regulation in the village level to eliminate the smoking area, and the family have also opportunity to make it TB and smoking cessation also limitation in that area. So that is very important, and maybe for the next future we also have another indicator. It's not in TB, but maybe in the smoking area. We in Indonesia have kawasan tanpa rokok or no smoking area. At least at the 6 area. So I think it's better. That one of the indicator in that because it is related to the government, the local government, and also the village. We better to put it then as part of the TB control itself. For instance, if in some or one or two village have another situation like this one, I think it's better for put it in the empowering of the family, the household, and also in the community. Thank you.
Thank you, Pa Anu. I think that family engagement in this whole process is really important, not only for the TB, but also smoking cessation and other, so they are the ones who take care of the patient in their own household. I think considering times, I think we have reached to here already 2:30, so there will be another session after this in this room. So to conclude this, I would like to request Dr. Okada to make a concluding remarks.
Thank you so much, Dr. So this is really historical. The first time to discuss smoking TB committee and the union as well. So in that sense, really, and then we have how many virtual participants? 30, more than 30 plus in the floor. More than 10 participants. So hopefully that we go together, and then the smoking control in the context of the TB control, we can successfully implement and then expand it, and then to reduce the hazard of smoking also from the tuberculosis control as well. So this is really the breaking point as well. Thank you so much.
Thanks, Dr. Okada. I think that I would like to thanks to all both all the participants online and also here legal presence. So it's really great. So we'll come up with some concrete the points from this the meetings, and then we'll share with all of you by emails. And also tomorrow morning at 8, we have also meet the expert session on the TB and smoking cessation. So please feel free to join that meeting as well.
Which room, sir?
Or that's the room. I forgot the room. In the expert session is the room
B4A. B4A.
B4A.
B4A. Yes.
Yeah, in the same.